Just ask my father. Breaking a hip can be a huge setback. But today, there are ways to get people back on their feet again, doing the things that they love.
Yes, UConn Health has developed an orthopedic clinic for patients post-surgery.
It's a one-stop shop for all of their care and education. Melissa Cole stopped by recently. Take a look.
The main thing we encounter as orthopedic surgeons is fractures after a fall. All of our skeletons start to thin out, actually probably in our 20s and 30s, and that accumulates over time. So that's why we see it more frequently in the older population.
Orthopedic surgeon Dr. Adam Lindsay at UConn Health says the hip, spine, wrist, and shoulder are the most common areas for broken bones after falls. The risk of these fractures increases after the age of 65.
Hip fractures in particular, really what we're talking about is fractures at the top of the thigh bone or the femur bone, often require surgery because those breaks are very painful. Patients can't get up and walk, they can't get up and mobilize, they can't do the normal activities of daily living, and we have good, reliable surgeries that allow people's pain to be controlled quickly.
Here at UConn Health, they've developed a fracture liaison service.
If you have a fall and you break a hip, we get you admitted to the hospital quickly. We have a multidisciplinary team of medical doctors and obviously orthopedic surgeons, anesthesiologists that get you prepared for the operating room. We get you in and out of the operating room quickly and safely, and then we get you discharged from the hospital.
UConn Health also built a clinic outside of the hospital to monitor a patient's recovery. Nurse practitioner Jill Akari-Couture is part of this program.
About 6 weeks after surgery, they come and see me. That's when I make sure that their hip fractures are healing well, their x-rays look good, the bone is healing, everything's in position, they're starting to be active.
During these appointments, patients also learn how to reduce the risk of future falls and broken bones.
My job is to educate them, to make sure that they and their family know their risk factors for another fracture, to make sure that they're eating well, to make sure that their vitamins and minerals, everything they're taking is working towards no more fractures.
How important is it for them to come here and get all that information as opposed to just trying to do it all on their own?
So it's really important for them to come get all of their questions answered. I spend as much time as they need with them. If they have questions regarding future care, if they have questions regarding future fractures, many people are just fearful after a fracture. And we want to reassure them that we are here, we're going to take care of them, we can answer all of their questions, we're available, and we're going to prevent as well as we can any future fractures.
I think we've been really happy with our progress. That's our number one goal is to try and get you through the break itself and get you back to your normal life, 100%.
Yeah, well, it's nice to just have it all in one spot. To learn more about UConn Health's orthopedic clinic for patients, visit health.uconn.edu.